Hi, I'm Sullivan, and I'm here to talk to you about the major mineral phosphorus. Phosphorus is the second most plentiful mineral in the body, behind calcium. It makes up about 1% of your total body weight. It is present in cells and tissues throughout the body, and about 85% of phosphorus is found primarily in the bones and teeth. Major functions. Phosphorus plays a major role in the formation of bones and teeth. It assists the body in making proteins for the growth, maintenance, and repair of cells and tissues. It also plays a major role in enzyme activity. A number of enzymes, hormones, and cell signaling molecules depend on phosphorylation for their activation. It also helps the body make ATP, which is a molecule the body uses to store energy. It then decides how to use it. It filters out waste in kidneys, aids in the production of RNA and DNA, which are the body's genetic building blocks. It assists in muscle contraction, and it helps to maintain a regular heartbeat as well as reduce muscle pain after exercise. The adequate intake for 0 to 6 months, it's suggested that you consume 100 milligrams per day. 7 to 12 months, 275 milligrams per day. 1 to 3 years, 460 milligrams per day. 4 to 8 years, 500 milligrams per day. 9 to 18 years, 1,250 milligrams per day. And adults are suggested to consume 700 milligrams per day. As you can see, with age, the amount of phosphorus you should consume varies. Adults need less phosphorus than children between the ages of 9 to 18, but more than children who are under 8 years of age. At this point in our lives, as adults, we should be ingesting 700 milligrams per day of phosphorus. Sources. Most people get the necessary amount of phosphorus they need through their daily diets. If your meal contains enough calcium and protein, it is likely that it also contains adequate amounts of phosphorus. Foods rich in protein are excellent sources of phosphorus. Examples include meat, poultry, fish, eggs, milk and other dairy products, nuts, beans, and seeds. Non-protein sources are great as well. Foods such as whole grains, potatoes, garlic cloves, and dry fruit are great. Whole grain versions of bread and cereal contain more phosphorus than those made from white flour. However, phosphorus in whole grain foods are stored in a way that can't be absorbed by humans. An interesting source of phosphorus is found in carbonated beverages. The phosphoric acid is used to produce the carbonation in sodas. However, I do not recommend this source. Poor sources include fruits and vegetables. So if you're an individual with high levels of phosphorus, this is a good way to get nutrients and some phosphorus without ingesting high doses of phosphorus. Signs of deficiency. Deficiency of phosphorus is not usually the case because it's so readily available in our food supply. In fact, it is more common to have too much phosphorus in your body than too little. However, due to some medications such as antacids or certain health conditions such as diabetes and alcoholism, the body's phosphorus levels may drop. Other individuals at risk are either starving or anorexic. Inadequate phosphorus intake resulting in abnormally low serum phosphate levels is known as hypophosphatemia. The symptoms of hypophosphatemia include bone malformation, bone pain, muscle weakness, loss of appetite, fatigue, and irritability or anxiety. Symptoms of toxicity. Because phosphorus is in the majority of foods we eat on a day-to-day basis, it is common to have too much phosphorus in your body. That being said, it can be toxic to your body. The abnormality of having elevated phosphate levels is known as hyperphosphatemia. Because the kidneys are very efficient at eliminating excess phosphate from circulation, Hyperphosphatemia from dietary causes is usually only a problem in people with kidney failure. So those who experience too much phosphorus typically have kidney disease or some sort of trouble regulating their calcium. Some effects of too high levels of phosphate include altered calcium metabolism, which can form mineral deposits in your muscles, diarrhea, hardening or calcification of organs and soft tissue, most commonly the kidneys, and osteoporosis. As the amount of phosphorus you eat rises, so does your need for calcium. So there's a delicate balance between calcium and phosphorus, which is necessary for proper bone density and prevention of osteoporosis. To avoid the adverse effects of hyperphosphatemia, the Food and Nutrition Board set a tolerable upper intake level of 4,000 milligrams for oral consumption in generally healthy individuals. This upper intake level does not apply to individuals with significantly impaired kidney function or other health conditions known to increase the risk of hyperphosphatemia. Dietary supplements. Phosphate is the drug form salt of phosphorus. They are used as dietary supplements for patients who are unable to get enough phosphorus in their regular diet, usually due to certain illnesses or diseases. Sodium phosphate and potassium phosphate salts are used for treatment of hypophosphatemia under the supervision of medical people. Some side effects may occur. Less side effects include nausea, diarrhea, vomiting, and stomach pain. These are the most common, but they usually subside after a few days of therapy. However, stop taking your medication if you're experiencing an allergic reaction and seek medical attention immediately. These more serious side effects include difficulty breathing, closing of the throat, swelling of the tongue, lips, and face, and hives. Excessive intake of phosphorus supplements may worsen conditions such as heart disease, pancreatitis, high blood pressure, and liver and kidney disease. Further, too much of it can lead to potentially serious electrolyte imbalances and even death. So please, please, please consult a physician before you start taking phosphorus supplements. Ooh, is there a food label? Use it. While many nutrients are listed on the nutrition labels of the food you buy, it is not required by law for phosphorus to be listed on labels. Therefore, it is rarely included on the label. However, if it is, read the label. You can use this guide to help gauge your phosphate level. So, if you're someone with hypophosphatemia and you're looking for greater levels of phosphorus, you should find foods containing greater than 150 milligrams or more than 15% of the daily value of phosphorus. Foods containing 51 to 150 milligrams or 5 to 15% of the daily value are medium high in phosphorus, and foods containing 0 to 50 milligrams or less than 5% of the daily value are low in phosphorus. So in the case of hyperphosphatemia, go for the low phosphorus. However, if phosphorus is not listed on the label, check the ingredients. The ingredients list anything and everything if it's in there. And if the word phosphate comes up, it is very high in phosphorus. So check the ingredients. Now I'll talk to you about my research article. The title is The Association of Dietary Phosphorus Intake and Phosphorus to Protein Ratio with Mortality in Hemodialysis Patients. I included the reference if you want to take a look at that. The hypothesis being examined is that the higher dietary phosphorus intake and higher phosphorus content per gram of dietary protein intake are each associated with increased mortality in patients suffering from chronic kidney disease who are currently going through treatment. The participants were outpatients who have been undergoing treatment for at least 8 weeks, are older than 18 years old, and have signed a consent form. Patients with an anticipated life expectancy of less than 6 months were not included, and out of the 1,300 patients, only 224 participated, and those were followed up for 5 years. The design incorporated a food frequency questionnaire to conduct a cohort study to examine the survival predictability of dietary phosphorus and the ratio of phosphorus to protein intake. Other measurements taken were blood samples, anthropometric, and body composition measures while the patients were undergoing treatment. Through this study, it finally was determined that the higher the dietary phosphorus intake and the greater the dietary phosphorus to protein ratio was, greatly associated with an increased death in patients experiencing MHD at the time. Even after the adjustments for the serum phosphorus, the type of phosphate binders used, and dietary protein, energy, and potassium intake. These findings, which should be verified in other studies, suggest that the least possible phosphorus content accompanied by a protein supply should be recommended to people with MHD. Now it's time to look at a video. I would like to show this video that sort of ties everything together on phosphorus while shedding another light on the subject. The purpose of this video is to educate people and help them grasp a deeper understanding of chronic kidney disease and the impact of food choices as well as treatment options. So let me get that for you. Here we go.
Like John, over 1 million people worldwide have chronic kidney disease and undergo dialysis treatment. John's damaged kidneys have trouble sufficiently removing waste, excess water and minerals from his blood. Phosphorus is one of the minerals essential for maintaining healthy bones, teeth and energy. It is present in varying amounts of common foods such as those shown here. Phosphorus is absorbed into John's bloodstream during digestion when it goes through his intestine. Normally, excess phosphorus from food is removed from the body through the kidneys and is eliminated through urine. Because of John's CKD, his body needs help to efficiently process excess phosphorus. Excess phosphorus could be dangerous for patients such as John. It can weaken his bones and cause serious heart disease. There are 3 things that John does to actively maintain his health and contribute to controlling the phosphorus levels in his body. John pays attention to what he eats. It's not always easy, but he does his best by cutting back on phosphorus-rich foods, such as dairy products, dried beans, nuts, cola drinks, and especially processed foods, which contain chemical additives, which are phosphorus-rich and more rapidly absorbed by the body. Generally, CKD patients should avoid additives such as E338 and those which contain the reference to phos in the ingredient name. John regularly goes for dialysis sessions which remove waste and excess water from his blood and help to restore proper electrolyte balance. Dialysis also helps remove a small portion, but not enough, of the excess phosphorus from his body. Because of this, John also takes a phosphate binder with every meal according to his doctor's instructions. The binder captures excess phosphorus in his intestine and prevents absorption into the bloodstream. The captured phosphorus is then flushed out of John's body. While physicians and dietitians carefully plan lifestyle changes for CKD patients, it remains a challenge for John and patients like him to adjust to dietary choices, regular dialysis sessions, and phosphate binder intake. Take a journey inside John's body and understand how excess phosphorus can be captured by phosphate binders during digestion.
Okay, so now I would like to propose a question, and something that was touched on in the video that I hadn't really talked about before is what a phosphate binder is exactly. A phosphate binder is a pill your doctor has prescribed to control the amount of phosphorus in your blood. So how it works opposite to supplements, which are there to help with hypophosphatemia, this helps to work with hyperphosphatemia. They bind to or soak up phosphorus in food during digestion, and then the binders and phosphorus are moved through bowel movements. If a binder is not taken, phosphorus can accumulate in the blood. So this is the best way to lower levels of phosphorus and prevent phosphatemia. Okay, well, that's all I have for you. Thank you so much for listening, and I hope you enjoy the rest of your summer, and I hope you learned something. Thank you.